else now. 'Cause
I think,
like I
I
mentioned
think I heard
earlier.
Arno say
People do
two
burn their own
things.
houses down. I mean,
I think,
but we
their
still
houses
send the
down.
fire department. You know,
Exactly.
people set their own houses on
Right.
fire.
For the people next door.
Yeah.
To put out the fire for the people next door. I think I've heard you say two things. One is you feel reluctant to be put in a system full of people who aren't taking care of themselves.
That's it, yeah.
And
That's
to
it,
that, I
in a
think what
nutshell.
we say back to you is, tough luck, buddy. You're already paying for all of their care.
Right.
And in fact, because they're not, seeing the doctor on a regular, doctors make a huge influence on whether or not people keep smoking, interestingly enough. So you end up paying one way or the other. So that I think we can handle. The other thing you said is maybe a little bit more profound and difficult, because the other thing you said is, I don't like it when government tells people they have to do something. It may be quit smoking, or it might be buy insurance. And we are kind of saying, yeah, the whole community is saying, you gotta put in for the healthcare system.
Right.
And the analogy we're making is it is a little bit like fire and police. It's not okay for people to say, I don't want to be part of roads, fire, police. And what we really are saying, you've got to somehow be part of the system that creates the health system as a community good.
It's health insurance.
One point I'd like to make about personal responsibility, that people's bad health care is not necessarily only a matter of personal ignorance and irresponsibility, because we have an advertising system that bombards people from childhood to drink.
Again,
to
so
smoke.
now we're gonna tell companies that they can't
No,
advertise.
but you
or-
get those messages in
You know,
your head,
it's-
bombarded
If
in
they
your
want
head.
federal benefits.
The one thing I
Well-
learned when I was in a master's program in educational technology is that the best way people learn is by repetition of the message. And advertising is repetition of the message to the point where it's in your head and you don't even know how it got there, and it's something, it's just part of who you are. It's part of who you are. And so I'm saying that somebody who has a message that's basically been brainwashed into their head, they're not totally irresponsible for consuming things that are advertised that aren't good for them.
We can't regulate speech willy-nilly in this country for a very good reason. But the interesting thing is, so many industries benefit and need government benefits so greatly that we can have enormous influence on. Somebody was saying recently, if we could only get, at this meeting, if we could only get Viagra ads off the TV, and that was only recently allowed that they be on the TV. And we could go ahead and forbid it again. But we could also say, oh, by the way, if you advertise Viagra on TV, it will never be reimbursed by the Medicare program. It would have the same effect overnight, and it would be 100% voluntary.
Right.
There you go.
Are you
Well,
saying?
that I don't have as much of a problem.
Right.
Can I-
There's ways and ways.
Can I go back to your original point? Are you then saying that we should amend Obama's plan to make it obligatory, at least for a basic health insurance, because of adverse selection problem that you have in insurance, right? If you just have, which you're just free to not select it, then you just go to the doctor when you need it, and then you are just free riding on the system, right?
Yeah.
So.
That's the other reason we support the concept of universal insurance, is whenever you have insurance for some people, inevitably the sickest people migrate to that system, and it becomes an economically disastrous system because the well people will migrate somewhere else. So unless you put everybody in the same pen, you end up having an unaffordable healthcare system. And this is what other countries have learned.
One of the things that concerns me in the way that I believe that this is written is that they speak about assuring that everyone has health care coverage, and then separately about underinvestment in prevention and public health, and we should strengthen public health and prevention efforts, but we don't tie prevention back to the insurance industry paying for it. We sort of have made it this public realm that the public all of a sudden will be responsible for prevention, which is really key, that the community does drive what we do, as we've just been speaking about as far as smoking goes. But this has to come from health professionals too. It really does. And so we have to have prevention at the health professional level be key to what they're doing. That's why the physicians have been talking about strengthening the primary care system.
But I think, I worried about that a little bit when I read the first summary page. But when you go inside, he does talk about, or they, and it wasn't just him, making sure that best practice prevention activities are integrated in what we pay for health care.
Okay.
But what he also says, and this is important to me, is that we have to pay for government public health services, that the healthcare system by itself won't do the things that public health does.
Well, I guess-
Environmental, community planning, those things won't be done by hospitals and doctors.
Okay, I definitely
And I
agree
think
with that.
that's what he's referring to in
But
the
I would hate to
third,
think that we've taken prevention out of the realm of the insurance product that will be offered.
I thought he had put it back in later, and I'll see if I can find it for you.
Okay.
Seems a takeaway though, and I mean, would you agree then that Obama's policy really is geared towards prevention? Or at least doesn't highlight prevention as much as?
Well, I think it does.
should?
I would certainly hope that it doesn't give private health insurance, proprietary private health insurers the option not to cover that because it's covered in the public realm.
Very good point.
Yeah. That there are personal preventive health care services as well as the public preventive health care that we all need. Okay.
The last couple of pages, promoting prevention and strengthening public health. This is on the long version.
Okay.
Yes, the second line.
And line in the sounds very slow, so
Okay.
I see.
Simply put, in the absence of a radical shift towards prevention and public health, we will not be successful in containing medical costs or improving the health of the American people. Facing a true epidemic of chronic disease.
Okay, I was looking at this yellow sheet and.
Do you have the longer one?
Yeah, I got
Oh, it's
one.
wonderful.
I just wanted to be sure it's in there.
It is.
Along with what you just quoted for me, I'd love to see an increased amount of research. We're all living longer. An increased amount of research in what we can really do, and it won't just be health and medical research. Although that will be a very important part of it, to make the quality of life for people at the end of their years better and more cost-effective, because so much of it is paid for with healthcare dollars. How are we really going to do that? Do we have to organize the way people live or the way people are cared for, or get more and more people used to the fact that the latest and the greatest technology that costs thousands and thousands of dollars cannot be done right up until the day before you die, thinking that you're going to get so much, it'll give you an extra week or 2 weeks. While certainly we have to help people make those decisions themselves and empower the elderly to begin to think about it. And I think an awful lot of them are thinking strictly from a financial basis, because everything costs so much right now with the limited number of dollars that we all have. So that will happen to all of us.
Yeah, long-term care isn't in here anywhere either. And
Yeah.
there may be a separate
I think there is
platform.
some. But just back to promoting prevention, Barack Obama believes that protecting and promoting health and wellness in this nation is a shared responsibility among individuals and families, school systems, employers, the medical and public health workforce, and federal and state and local governments. Each must do their part as well as collaborate with one another to create the conditions and opportunities that will
You should
allow
add-
and encourage Americans to adopt healthy lifestyle.
You should add community organizations in there. There are a lot of community organizations in Milwaukee now. They're establishing neighborhood walks where for safety they're organizing groups to walk together, because a lot of the neighborhoods where people are not safe, they're not going to go out and walk, and they're not going to let the children go out and play in the park. So they're creating a neighborhood support system where they will walk in groups and they will, feel safer so they can exercise.
I think I went to a Board of Health meeting the other night. Marilyn was talking about even under the preparedness and bioterrorism, creating these neighborhoods of care, where the only way that we'll ever get through any kind of a tragic event is if neighborhoods begin to band together and to care for each other. And I think we've all seen that on the rare occasion something very unusual happens, like it's 20 degrees below zero. And somebody that would never give it a thought is asking the young mother next door if she needs anything because he's walking to the store, you know, so she doesn't have to come out with her baby. But so I do think that it is possible to do that, but that needs to be a way of life, not a rare occurrence.
Exactly, and you know, since Obama is big into grassroots movements,
Right.
it can't get more, you know, better than this.